The National Health Insurance Scheme, the NHI, now goes to the National Council of Provinces. After being passed by the National Assembly yesterday, the ANC, some of the smaller parties, voted in favour. The DA and the EFF both voted against it. Peter Attard Montalto is the Director of Intellidex and Global Lead for Capital Markets Research there, someone who's been studying our society for many years. Peter, good afternoon to you. A huge amount of opposition, a huge amount of commentary about the NHI. One of the key questions is, can we really afford it? Is there any idea of what the cost will be, of how it actually changes the way our numbers work?
Well, I think this whole debate around the passing of the bill in the National Assembly has been quite bizarre. The thing is not going to happen, I think, within any reasonable time frame. It is simply impossible, logistically, in terms of the lack of tracking and pathway management systems that are in place, and in terms of funding as well. Now, the big problem we have on funding is that there is no detailed implementation plan that has been published. So we have to go off some very broad brushstroke numbers that based on the sort of broad outlines of the NHI Bill. But, you know, we move from a sort of lower bound total funding. This is net of existing expenditure, obviously happens in the state anyway, of about 170 billion from 2025. On the lower end, up through 300, which is roughly the base balance, of 460 billion on the upper end. This is a huge range depending on how you look at this. But even on the lower bound, that's an extra 170 billion of expenditure. You needed very, very sizable changes in revenue policy to be able to fund that, which just are not politically, practically or economically feasible.
In other words, you would have to increase the amount of tax, and already there are debates around whether or not the people who are currently paying tax, and the fact that the number of people who pay tax is relatively small compared to our population.
Yes, so you have a very narrow tax base, and so you have to go very far down in the income spectrum, for instance, on income tax, the same for corporation tax. You can't just sort of tax this very thin sliver of people on the top and expect to raise that amount of money. It's the same for a wealth tax, which would take years to implement even if it was possible, and we were also very skeptical of the amount that it would actually raise. But you would need a broad brushstroke of different measures, in particular including much easier to implement tax sites such as VAT. You probably need to see a 3-odd percentage point VAT increase just to start to contribute something towards that lower bound of 170 billion cost estimate I laid out. But on top of that, you would need a payroll tax, Treasury has said in the past, and some other forms of tax hikes as well. We'd be talking about a very, very broad tax increase to fund this, which is possible, but would have very deeply negative economic consequences off the backside of it.
I suppose the other question would be, if we were to do that, change tax policy, get a lot more money from people to fund healthcare, whether the NHI would be the best way to spend that money. There are plenty of people who oppose the NHI. They would probably argue that what we should really do is improve both the management and the quality that people get in government hospitals.
Well, exactly. I mean, there's a broad range of things that need more spending, right, including, let's not forget, education, early childhood development, in particular, a basic income grant, if you believe in that as well, which is, you know, hankering after similar sort of quantums of money. And that's, I think, really the problem in these debates is we sort of assign tax increases notionally to different policy ideas, but there's only one set of tax increases potentially to go around so many different changes. But no, let's not forget, South Africa needs some form of better health care for the vast majority of the population. It needs an NHI of some variety. It just isn't this thing that is now passing through Parliament. There are, of course, other methods. There are other discussions to be had about ultra low cost private medical aid, things like that, which could move as well. But you know, I don't think this is the answer. I said at the start, I don't think this will happen or be implemented in any reasonable time frame.
There's so many other things that are going to happen. I mean, it seems likely it'll go to the National Council of Provinces, pass there, be signed into law, and that's when the legal challenges will start and things will sort of get stuck in the mud at that point. You and many other commentators have made the same point, that it may not happen for lots of reasons. Does the fact that we're having the debate, that it's been passed, the fact that people are talking about really big changes to our healthcare, actually have an impact on our healthcare sector, our private healthcare sector, which does, rightly or wrongly, have a big impact on our economy?
Well, we've seen a wobble today in bond markets, in some of these stocks, as it got passed. I think people were slightly asleep on this. Remember, nothing had happened for so long. Treasury sort of stopped talking to investors about this even 3 or 4 years ago, which was on the back burner so much. So there is some impact in the short term like that. My worry is the debate hasn't actually really generated those alternatives, those things we actually need to implement to improve healthcare provisioning in the country. But the next big step, I think, on implementation, as I said, there isn't an implementation plan really to speak of. The department says there isn't really at all that you can get your teeth into. The key question now is what the private sector responds and does. Government is going to look to the private sector to basically pick up the pieces where, for instance, they don't have these pathway management and patient management systems that the private sector does. And that is a very complicated and difficult discussion, I think, that will then start.
So many different things are going to happen here. And there's also the fact that it could just damage the private healthcare sector because doctors may leave. People working, nurses may think, well, I don't want to work for the NHI, and it's quite uncertain. So we have a bit more uncertainty in our society once again, one way or another. Government is perhaps going to be accused of making things less certain.
Well, that's the problem with a baseline view that this is not going to happen in any reasonable time frame. You're still going to have negative impacts on sentiment and on, as you say, on the uncertainty around the place. Now, there's often a lot of criticism. I've been criticized in the past around, offshoring of people when you sort of hike tax and things. But people have a behavioral response. People will move abroad. We're already seeing a huge flight of nurses and doctors in South Africa to Australia and elsewhere, and that would just accelerate. That is, I think, just a fact. That's not particularly doom-mongering, and I think we have to consider all these things together and how you solve them. I mean, we still haven't seen the private sector being allowed to train nurses, for instance, in South Africa. But no, I mean, I think it's like Saab nationalisation, it's like land reform, like all of these things. We end up having to navigate through a swamp of uncertainty, even with negative consequences, even if these things don't happen.
Peter Attard Montalto, thank you. Director at Intellidex and Global Lead for Capital Markets Research there.